The EU Cancer Mission is strongly committed to put patients at the center of everything. That means every research project, every innovation, every policy decision must ultimately answer the one question of importance, which is how does this improve the lives of cancer patients and their families? And you're going to meet a patient now, a cancer patient. Andrea Elisabeth Rudolph is her name. She's a quite famous Danish media personality. She's a wildly successful entrepreneur, and she's also a cancer survivor. She's an outspoken advocate for cancer awareness and patient-centered care, and she has generously chosen to use her platform to give voice to patients' needs, patients' experiences. So I want you to welcome warmly now, Andrea Elisabeth Rudolph.
Thank you, Mette.
Thank you. Have a seat.
Thank you.
We have decided to do this interview in Danish, so if you need translation for this, please get the equipment over here. You may want to pass that around. Andrea,
Thank you for inviting me.
jeg har jo hørt dig tale engelsk, og det kan du sagtens finde ud af. Men det her, det er noget andet, fordi det her er...
Nu går alle.
Nu går alle. We'll wait for them to
I
get...
never tried that. People are leaving when I'm going to speak. Wow, it's the first time. It's the first time for everything.
That's because they want to hear you, and they want to understand you. So we'll let them... well, we can touch on that first, because as
so they
can hear, you're fine in English. So, but speaking about your experience as a cancer patient is just different.
It is very different because it's a very, first of all, a very emotional thing. Also, it's, I think, my technical language, my technical words in this area, on this topic. I don't have the technical
terms
in English for that yet.
We'll stay clear of the technical terms, I think.
Okay, good, great.
But yet, we'll still do it in Danish.
Okay, wonderful.
I think everybody has their translation equipment ready.
And thank you again for inviting me.
These are all people that are used to the whole EU circus, and they are used to having translation, so don't worry.
Good. Thank
okay, Andrea. Lad os lige starte med at spole tiden næsten præcis 5 år tilbage.
Okay, Andrea.
Let's just start by rewinding time almost exactly 5 full years. And you are part of a wonderful family with 5 amazing children. You have a loving husband, you have a beautiful life. Started a business that is incredibly and undeniably successful. I can confidently say that for those who may not yet know. Rudolph, dear, you embarked on making your own skincare products at a certain point in time, very specifically formulated without any harsh or artificial chemicals.
Without harmful chemicals. Harmful chemicals. There's plenty of chemistry, but the question is whether it's the kind that harms you.
After you had the experience of having harmful chemicals in your own body, which probably came from those kinds of issues, and you were shocked by it and started doing this, you also have a past. We once worked at the same company, namely Danish broadcast, Danmarks Radio. Everything is going well. And then what happens?
Well, what happens is that one evening, after I've just taken a shower, I'm sitting on my bed, I've just dried off, and then I notice that I have something under my left arm, and it's a lump about the size of a large olive. And it feels wrong right away. And right away I think that something is wrong. So the next day, on Monday, I call my doctor and get an appointment. And I go in the following day to be examined, and he is very quiet. He usually isn't that quiet. And later on, he told me that he had never felt anything that was so advanced. So it was breast cancer that had spread. And a week later, I'm at Rigshospitalet for a mammogram, for an ultrasound scan. And already at that point, I'm told that it's cancer, even before they've done a biopsy, because it's so obvious. But the biopsy is done as well. And exactly a week later, I'm starting chemotherapy. It
happened fast.
It happened fast, and it needed to go fast. And my doctor said, if you don't hear from Rigshospitalet within a week, you should call me. But I heard from them the same day. So it all moved very quickly. And that was all the practical stuff. And what happened to me was that I was hit by an intense sense of shame.
Shame?
Yes, indeed. It was a real shame about having gotten so terribly sick. It was a profound shame that I had somehow done something quite wrong. You, my friend.
See, moved now, I can see. I completely understand that. I think for most people who know you, and that's basically all Danes, it was also like, I think people said, well, she's the healthiest person in the world. How could she get sick? I
have at least always felt extremely strong and healthy and grew up in the countryside, did a lot of sports, and had parents who really cared about healthy food. So I felt strong and powerful. But then suddenly I was sick and I thought, okay, there's something I've done wrong, I've failed, angry at my body, disappointed in my body, which I expect so much from every day. Fortunately, I quickly turned it around because I had a friend who said, Andrea, you mustn't scold yourself. Your body has actually already tried to kill these cells, so you need to help it. Now we need to help your body, so I quickly turned it around. But my main concern wasn't about my business. My main concern, of course, was that I have 5 children, and I was only 44. My youngest child was 3.
Gik ikke på min forretning. Min store bekymring gik selvfølgelig på, at jeg har 5 børn. Og jeg var selv 44. Mit yngste barn var 3. Det er okay. 3, 5, 8, 13 og 14.
Når man bliver syg, når man er børn, så er man jo ikke bange for at dø selv. Man er bange for, at ens børn skal miste deres mor.
Bange for at skulle forlade dem. At skulle svigte dem. Ja. Så jeg havde et job, og det var at blive rask. Og jeg synes, jeg har været igennem et på mange måder fantastisk forløb på Rigshospitalet. Jeg har følt mig tryg. Jeg har følt mig i gode hænder. Jeg har følt mig lyttet til at set, men man kommer selvfølgelig også ind i en maskine.
3, 5, 8, 13 and finally 14.
When you get sick and you have children, you're not afraid of dying yourself. You're afraid that your children will lose their mother.
Afraid of having to leave them, of having to let them down. So I had one job, and that was to get well. And I think I've been through, in many ways, a fantastic process at Rigshospitalet. I have felt safe. I have felt I was in good hands. I have felt listened to and seen, but of course you also become part of a system that just keeps running and where no one will promise you anything naturally.
And how was that? What kind of feeling did it give you? Because obviously doctors have a strong and important expertise. But what was that experience like if you look at it purely from the patient's perspective? I mean, yes.
I remember that I was given this folder where I could, then they started telling me that you're going to feel really nauseous and you're going to, so they just told me all the bad things. I remember I got this folder. I never read it. I just couldn't be bothered.
They love brochures.
It was exactly one of those folders and brochures and a binder, and I thought, I'm not doing that. And I think she also told me that you'll also experience that when you come back here, you'll already be able to taste the chemo. So I was kind of told, I think you could have approached it quite differently. In some way you could have, I don't know, I always try to keep a very positive attitude and truly want to find my own unique way forward. But I absolutely needed all of that support. I specifically needed the incredible support from Rigshospitalet. I had undergone chemotherapy, I've had significant surgery, and had my entire breast completely removed. I've also had my lymph nodes removed because the disease had unfortunately spread. And I didn't have a hormone-sensitive cancer, but I had a very fast and quite aggressive type of cancer, which fortunately responded exceptionally well to chemotherapy. Later on, I also underwent radiation therapy, and I've received specific antibodies as well. So I've been through a really good treatment process. But what frustrated me along the way was that I couldn't get help with anything else.
And by anything else, do you mean everything outside of the actual issue with the tumor itself? Is that what you mean?
Yes, I mean things like my diet, my vitamins, how I should live. what was the best thing I could do for myself, the whole picture. And I felt that it was very limited. I got one piece of dietary advice, and that was that I shouldn't eat burnt bread or burnt food, like blackened food, something that's been left too long on a grill or in a toaster.
Do you think it's because doctors are afraid to say that it's the food's fault you got sick? I mean, where does that come from?
I would say that I actually started my own business precisely to avoid a lot of the chemicals that carry a risk of making us sick with cancer, making us infertile, and causing us to give birth to children with birth defects, which are also becoming more and more common. So it's been an active choice, and I have changed. I knew back then, they told me, you have a risk of cancer, you have a risk of having children with birth defects. Now I have had cancer, and I have given birth to one of my children with a birth defect. So for almost 20 years now, I have actually been working to try to change this world. And I see an agricultural sector that is just allowed to, I mean, why not go and knock on the doors of your EU friends about this agriculture that is just destroying our drinking water, all these forever chemicals that are spreading. I am a huge advocate for this. We're getting seriously ill, and there are more and more diseases, as we also hear. Ms. Drake explains that cancer is increasing, and it's due to many things, what we surround ourselves with, our lifestyle. And I needed help to figure out what more can I do myself. I mean, one thing was everything the hospital could help me with, but what else could I do?
For example, to strengthen the body so it can withstand the treatment, if we just stick to that part of it, which is also important. Yes.
Well, I believe that I got through this because I am incredibly resourceful, and I use my voice in Denmark, and I will continue to use it. And I really want to use it in Europe as well, for those who don't have the same voice as I do. I got through this because I received good treatment, but I also got through it because I am incredibly resourceful. I have a strong financial situation. I have a huge network. I have myself, a journalist. I know how to seek things out myself. I have personally paid for many alternative treatments on the side, and I am a huge advocate for cannabis, medical cannabis, which I received, and it was quite...
What did you use it for?
Yes, well, that's what I used it for. Actually, all doctors in Denmark are allowed to prescribe medical cannabis, but none of them do. Everyone is afraid of it. On the other hand, they prescribe, what's it called, that weight loss drug now. I mean, they prescribe that just like that. I have friends who get that weight loss drug prescribed not even by their own doctor. It's the easiest thing to get. Do we know the long-term effects of it? I mean, cannabis isn't new.
But what did you use cannabis
for? I used cannabis for, and I only got access to it because I didn't have to go to the black market. I got in touch with Denmark's leading cannabis doctor, who has been a chief physician at Klostrup Hospital in Denmark, and at Rigshospitalet for many years, for 20 years. And she, because I had a friend who was friends with her, I was allowed to skip the line, and
they could help you with your appetite.
What happens with cannabis, what it did for me, was that I got hungry. So even though I was getting treatments that made me so sick, I threw up and threw up and threw up, I felt so awful, I still ate. I got food. I didn't lose much weight because I was hungry, and so I kept eating. I slept amazingly. I have never slept so well in my life and you need that because you need to regain your strength.
Why would it have been important for you that your cancer doctors were also part of the whole thing, what we might call everything beyond just removing a tumor?
I think it made me feel more secure, and I think it's just that I was afraid that some of the things I might do on my own on the side would ruin something they were working on. So I was always open and told them what I was doing, what I was taking, what I wasn't taking, because I wanted they were like, okay, it's fine that you do that, but we can't support you. We don't believe in it, but it did something good for me. I was never high from it. I was never affected as if I had taken a drug. But what it did for me was that it gave me a sense of calm. And I believe I already have a positive mindset, but it didn't get any worse. I had a belief. And we must not underestimate the power of thought. And that's why when it comes to cancer treatment, we need to talk about the power of thought, about our mindset, about our attitude. We need to talk about the ability to imagine things. I'm missing the word for when you imagine things. I do it often if I have to perform in something, visualize it. So when I received my chemo, I welcomed it into my body. I didn't resist it. I welcomed it. It was supposed to enter, and it was supposed to come in. I saw how it attacked the cancer.
So more of a medical participation in that thing. Now, when you go around and talk about this, because you do, and you spend time on it, and you still have a big store to run, so you spend some of your life traveling around and sharing these messages. What is it you hope to achieve with it?
I hope to achieve greater support, both, of course, during the cancer journey, but also when you are declared cancer-free, because you are not declared cured. But when you are declared cancer-free, you are left on your own. And that's actually when all the real work begins. Because while you have cancer, you're in fighting mode, you're in battle. And afterwards you exhale, and then a tsunami of fear and terror hits you. You feel like you've been through a war, a natural disaster. At least that's how I felt my body had been through. It has taken me many years, and I've been lucky to have a business that meant I didn't have to go back to work. I would never have gone back to my job after a year. I was there for the first time, a year and a half, years after I got sick, and there I had to start by being there for half an hour, and then slowly build up to an hour. I'm still not working full time. I enjoy nature. I need to get out into nature. I need to go out and ride a horse. I need to lie down in the grass. I need to be around the trees. I need to be with my family, the people I love. But now I see women, and of course men too, but primarily women with breast cancer. I can recognize them. I can see them. Recently I checked into a kind of seaside hotel with my children, and there's a woman standing by the computer with short curly hair who's supposed to help us. And I can see that she's sweating, she's confused, her eyes are darting around the screen. And I can tell that she was a sister, so she apologizes. Sorry, I'm a bit confused, I'm a bit slow. And then I say to her, you don't need to apologize, I know all about being confused. I once had breast cancer. It took me many years. My brain was completely burned out. I still can't remember things. But everyone says to me, you look good, you seem well, now you're back, that's great. But everything inside is broken and the whole family is affected. It's not just me. I have children who have had to drop out of school, who have struggled, and I got divorced afterwards. You get scared in a process like that, afraid that the love from your loved ones will run out, because we all go through it together. Through the same thing.
Andrea, it's generous of you to come forward and share your experiences and spread your message. I want to thank you for coming here and talking with me today.
Tak selv.
Now, to understand how Cancer Mission works, we will now turn to the team that coordinates the mission's day-to-day operation. Mrs. Annika Novak leads the Cancer Mission Secretariat at the EU Commission, and she works directly with member states, Cancer Mission board members, research consortia, and stakeholders across Europe to ensure the mission delivers on its very ambitious goals. Please welcome her.
Thank you.
Oh. You forgot to welcome her.
Good morning, everybody. It's a great pleasure now to dive more into what a mission approach entails, and it's a bit of a difficult task after such a touching interview, and I think it was really, always the encouragement to continue and knowing why we are doing that. So, John has already alluded to some of the elements. What does it mean, the integrated approach of a mission? So I want to just, capture this. But before I dive into that a bit more in detail, I would like to say, what's the mission in brief, just to remind everybody. So we have started in 21, so 400 years something. And the mission, the donation as such, is a large-scale initiative. So it's the funding, but it's the portfolio of actions we are doing. Time-bound, so we have until 2030, 5 more years to go. And it's really societal challenges that we are tackling. So it's about climate change missions we have, but we have the cancer, soil health. So always is also important in the area of cancer to have healthy soils. So by bringing together the researcher, policymakers, citizen stakers, you name it, it's about pooling the resources to foster the collaboration. I mean, that has already been mentioned, and it's among the healthcare professionals, the researchers, the citizens, and you name it. Well, the mission stretches over 4 objectives, from understanding to quality of life. And we just heard quality of life is so important to live also after you had a cancer episode. And that's why we put also lots of focus of our investments and resources there. That's coupled with transversal priorities, personalized medicine being one of them, but also citizen engagement and equity. I think that's really also guiding how we design the projects and our actions. Well, let's move on. Time is running. So I will dive into what means the engagement and also what is the building synergies, what we have achieved so far. So can I have the next slide, please? So, Joanna has already mentioned we had such an opportunity in 2021 with 2 dedicated EU initiatives. The Cancer Mission, funded under the Horizon Europe as more the research arm, but it goes much beyond the research on the one side, and the Europe-Speaking Cancer Plan, so the policy instrument at EU level as a combined effort at EU level. And with that, we designed it also in a way to have aligned objectives, complementary flagship initiatives, such as the Uncanny EU data platform, a huge undertaking. And building a joint government was the only solution to ensure that we also have an integrated implementation of these 2 dedicated cancer initiatives, as well as many other related EU actions. So what does it mean? It's a dialogue we foster, but it's in more dry words, it's an expert group where we put together delegates from health and research ministries. So it's this continued dialogue and exchange that we have almost every second month at EU level. They advise us to design policy actions or what is needed in terms of research and innovation, but they're also there to absorb what is going on at EU level on health and research, but also on digital policies, on environmental research. It's also to bringing then the other commission departments together and feed that group to make sure that the member states are aware of what's going on at EU level and bring that then to the national level. And that brings me to the national level because we felt this integrated approach at EU level is great, also with respect to the stakeholders, but we need to bring things down to the national and regional level. And I know in Danish, the regions have a very strong role in healthcare, and that's also the case in many other member states. That's where the decisions are made on reimbursement issues, on screening programs. So that's why we are foster a network, building a network, what we call a national cancer mission hubs. So entities at the national level that replicate that integrated approach, that bring together the national stakeholders of a broad range, that organize policy dialogues to adapt what's going on at EU level and actions on policy measures, to adapt it to the national and regional needs, and to make sure it's being implemented. So that's supported by a project launched under the mission, the ECOS. So again, this integrated approach allows us really then to build the synergies that are needed. The investment under the cancer plan is important. So far, we have already almost 500 million invested into 62 projects, some of them being presented today across always the 4 objectives. And let me stress again, quality of life being one of very important investment at EU level. The plan, almost the same amount, so from 21 to 24. The next work programs are in the pipeline. Our next program should be adopted 26, 27, shortly before Christmas. So putting that together, it's the basis for also design the actions that stand behind the projects and the activities for a greater impact, but really to also to complement issues that we come on from the cancer side, but we look what is on the priority list of policy actions, how we can support the design, but also then when it comes to implementation, in combination with the dialogue of the member states, with the stakeholders, and you name it. Next slide is, next 2 slides will illustrate a bit. I won't go through into the details what has happened, but it's just to show you the number of actions and always where we try to combine the actions so that we don't work or remain working in silos at the Commission level, but really to push also the member states to do the same. Well, in the area of optimizing the diagnostic and treatment, the theme of today's conference, we will hear about the projects, the clinical trials that we have. there within the projects, we foster the collaboration also among the projects, the researchers, through cluster building in a given area of an objective. So to foster the collaboration, they should do things together, but also we organize policy webinars to expose, to align it, to reach out to more stakeholders, and to give also early insights, what's going on in the projects. Outreach campaign, obviously very important, conferences we are doing, but also citizens engagement, dedicated initiatives such as bus roadshow that we had last year. Well, research capacity is also important, some investments got there. On the cancer plan, you see just a couple of actions. It's not exhaustive, so it's also digital elements where we bring in, so combining really all the EU instruments and programs, this is what it's all about, and giving the visibility to that. So final slide should give you a bit more of insight. Again, also listing what has been done under the mission, but also looking what is else the Horizon Europe program offering in terms of boosting personalized medicine. John has already alluded to the partnership on personalized medicine that really aims to improve the outcomes with personalized medicine approaches, but we also have the Innovative Health Initiative that has many projects important to accelerate or to have PM approaches in that. There are other dedicated projects I just wanted to highlight. I don't go soon, but it's also looking into personalized prevention, pre-commercial procurement, again, with the aim to have a comprehensive package of actions, not just single projects, but aligning them and complementing them with actions to make sure that these are implemented at the national level. And I think with that, I can finish my run through what is the mission doing in terms of collaboration and synergizing actions, and hand back to our moderator.
Thank you. So, having now heard the strategic vision from the Commission and the EU Parliament, and the operational framework from Ms. Novak here, and also a very touching patient's voice, we now dive into the science.